Child sexual abuse causes more mental pain than physical pain. And this pain often lasts for longer than anyone realizes. Physical injuries may heal, bruises fade, the body recovers, but the mind remembers. When a child is abused, the first thing that breaks is not the body, it is the child's sense of safety. A child depends completely on adults for protection. So when abuse comes from someone trusted, the child's world collapses. The brain learns a dangerous lesson. The people who are supposed to protect me is hurting me. The fear does not disappear with time. It quietly follows the child into adolescence and adulthood. Many people ask, why can't they just forget? Because trauma does not live in memory alone. It lives in the nervous system. A child's brain is still developing. When trauma happens, the brain records it as constant thread. That's why even years later, a sound, a smell, or a touch, or a situation can suddenly trigger fear, panic, or numbness. The body reacts as if the danger is happening again. Another deep wound is shame. Physical pain ends, but emotional pain turns inward. Children often blame themselves. They think it must be my fault. This shame slowly damages their self-worth, confidence, and identity. Many survivors grow up feeling unworthy, broken, and invisible. Child sexual abuse also affects emotional and sexual development. It distorts boundaries. It confuses trust. It interferes with how a person relates to their own body and others. As a result, survivors may struggle with intimacy, relationship, or attachment, not because they are weak, but because their nervous system learned love and danger at the same time. Silence makes the pain heavier. Most children cannot explain what happened to them. They may be threatened. They may feel scared or confused. They may not even have the words. When trauma remains unspoken, it turns into chronic stress. This can show up later as anxiety, depression, anger, addiction, or unexplained physical symptoms. Science now confirms what survivors have always known. Early sexual trauma can alter the brain's stress and emotion systems. It increases the risk of post-traumatic stress disorder, PTSD, emotional dysregulation, self-harm, and psychosomatic illness later in life. But there is one truth that must be said clearly. The child is never responsible. Never. Responsibility always lies with the adult who abused the power and trust. And there is hope. The brain is not fixed. With the trauma-informed therapy, safety, and compassionate support, healing is possible. Survivors are not broken. They are adapted to survive. If you are a parent, teacher, or caregiver, or a counselor, your awareness can protect a child. If you are a survivor, your pain is real and help is available. Professional psychological intervention can heal. Talking about this is not easy, but silence protects abuse. Understanding protects the children.